My name is Kendra Lewis, and today I will discuss the Veterans Health Administration. We will explore the clinical quality of VA healthcare, the persistent access barriers veterans face, and potential reforms. This presentation highlights evidence-based research on outcomes, equity concerns, and policy considerations for improving veteran healthcare services. The Veterans Health Administration was created to address the complex, specialized healthcare needs of veterans, such as PTSD and brain traumas. Studies indicate that the VA consistently provides clinical care equal to or better than private healthcare systems. This dispels the notion that private healthcare is always the superior option for veterans' treatment. Public opinion, often influenced by media reports emphasizing delays, portrays VA healthcare as ineffective. However, evidence shows VA clinical performance is comparable to private providers. The VA's integrated care model enhances treatment coordination and effective medical record exchange across departments. Despite high clinical quality, severe access barriers persist within the VA system. Veterans often wait weeks or months for primary care appointments. Complex administrative processes make enrollment difficult. Delayed care worsens chronic conditions, leading to a decrease in veterans' confidence in the health system. Structural issues contribute significantly to access problems. A shortage of providers complicates appointment scheduling, and administrative inefficiencies slow enrollment. Rural veterans face additional geographic barriers. Delayed routine care can increase emergency visits and overall healthcare costs. Access barriers affect certain veteran populations more severely. Women veterans often face difficulties accessing reproductive healthcare services, and veterans of color report lower access to specialty care. Rural communities suffer from limited resources and specialists. These inequities necessitate a focus on healthcare equity in reform efforts. One proposed solution to VA access issues is expanding community care, enabling veterans to use private providers when VA services are unavailable or delayed. Proponents argue this reduces wait times and offers greater choices. However, this approach assumes private care is inherently faster, which is not always the case. Expanding community care has limitations. Increased private healthcare alternatives often lead to significantly higher costs without consistent improvements in veteran health outcomes. Private providers may lack expertise in treating military-related conditions like PTSD. Furthermore, community care can fragment services, reducing coordination. Reform should focus on improving access within the current VA system, rather than dismantling it. This includes upgrading scheduling technology to minimize appointment delays and expanding the healthcare workforce to increase capacity. Strengthening outreach can help veterans navigate enrollment, and prioritizing equity will ensure timely care for underserved populations. These are the references used for this video. Thank you for watching this video on the Veterans Health Administration. I hope this information contributes to a more informed discussion on improving veteran healthcare and addressing access issues.